Welcome to the Rivers Training for Birth. My name is Megan Russell and I will be your trainer today. On behalf of the state of Rhode Island and Quantimark, I wanted to thank you for taking the time out of your busy schedule to learn about this new system. The goals of this session are to understand the benefits of an electronic birth system, learn how to log in and search rivers, start and complete the information on an electronic birth record, print birth forms, and we will also talk about how to assign a medical certifier for certification. There are several benefits to the new Rivers birth system, which you will see listed on your screen. Rivers is a real-time web-based system that best meets the long-term needs of Rhode Island through improved collecting, registering, amending, and issuing of birth records. The new system also has an electronic process for the VAP, the Voluntary Acknowledgement of Parentage. You will also have the ability to abandon records and email certifiers to remind them to certify a record. Green check marks now appear on the resolved tabs in the record, and users are able to reset passwords and PIN numbers through the system. All modules, birth, death, and fetal death, are now available in one system. Facility users no longer need to enter certifiers into the library maintenance table. The state now handles that. And finally, new user enrollment forms are now available to residents through the Rivers system. This is an overview of how a birth is registered in the Rivers system. First, a birth event occurs at the facility. You, as the facility user, will log into Rivers and enter the birth data. If a voluntary acknowledgement of parentage is requested, you will complete the form. Next, you will designate a medical certifier. The certifier will accept the record, electronically sign with a PIN number, and the record is released statistically and legally for registration. With that overview of the process complete, now let's look at how it works in the system. This is what you'll see when you get to the Rivers homepage. Down here at the bottom, you'll see the Rhode Island Department of Health Vital Records office hours, and you can click the link here to report Rivers issues. You can also click this button here for new user enrollment. And here at the top, you'll see this orange button that says Log into Rivers. The terms and conditions, and then you'll be directed to the login page where you'll enter your username and password. If you forget your password, you can click Forgot Password, and then you'll enter your username and email address on file, and the system will send you instructions to reset your password as well as a temporary password. Next, you will be directed to a page which allows you to select your location from a drop-down menu. Many people only have one location, but if you do work out of more than one location, they will all be listed here, and you will just choose the one that you are currently working at. This is the global module, or sort of the landing page when you log into Rivers. Under Function, you can switch your location or exit. Under Tools, you can change your password or set up a printer. Under Help, you can get administrator help, learn more about Rivers, or contact the help desk. Most often you will start in the birth module, so that is where we will start today. Once again, under Functions, you'll be able to switch your location or exit, or you can enter the system in a variety of different ways. You also have the same Tools, Help section, and you can also view reports. Most often you are going to be starting in birth registration. And state law does require the filing of birth records within 10 days of the date of birth. So if your facility does have any older records, this pop-up will come up notifying you that immediate action is required to resolve those outstanding records. Up here in the upper left-hand corner, you'll see a variety of icons that will help us navigate the system more quickly and easily. You can start a new record, search for a record, save, cancel, abandon, And then the blue arrows allow you to work within your work queue, and the green arrows allow you to move between tabs. You can also access all of these functions and more under the record menu here. This is your unresolved work queue filter. You can filter all of the records at your facility by viewing all of the unresolved records, late records, incomplete or pending. You have several options here in this menu. I'm just going to choose all unresolved, and you'll see on the right-hand side there are 38 unresolved records at my facility right now that I can look through using this drop-down menu. The oldest records are at the top with the newest records at the bottom. I can also more quickly find records by typing a record that I'm looking for in the unresolved work queue, and it will pop up from the drop-down menu. I can also filter the records that I'm viewing by choosing the certifier. So if I want to narrow down the records by certifier, I would click one, and then I would see that this certifier has 7 unresolved records in the work queue here. Now, there are 2 ways to fill out records. Depending on your facility policies and practices, you may fill out records as a facility user in either of these 2 ways. The first way is by filling out records that have already been started by another medical certifier who has started the record in labor and delivery. So in this first example, I'm going to show you an example where a physician in labor and delivery has started a record, and then it is now in the work queue for me as the facility user to complete. So I'm going to open the record that I am looking for. And you'll see on the left-hand side, there are some tabs over here that have green check marks. And that means that those tabs are completed, and they have been completed by the medical certifier who started this record in labor and delivery. So you'll see that about half of the information on this tab is completed, and I'll just need to go through and complete the rest of it as the facility user. The mother's medical information is mostly complete, and the certification piece is also completed by the certifier who started this in labor and delivery. I would just need to go through and complete all of the unresolved fields, and then I could finish this record because it has already been certified. Now, depending on your facility policies and practices, you may be starting the record from the very beginning at your facility. So in that example, we're just going to go ahead and click the icon that says New, or you can start a new record by clicking Record New. And this will start a brand new record for you, a record that has not already been started in labor and delivery. You'll see on the left-hand side here, there are 12 different tabs that require information about the child and the parents, as well as the certification tab at the bottom and an optional comments tab. As you move through the record, you'll see green check marks appear when each tab is fully resolved and completed. If at any point you want to view your progress, you can click unresolved/stakeholders, and it will show you all of the unresolved fields, and under record status down here at the bottom, you will see the next steps for your record. So as we move through a record, we can click that again to see what is still left that still needs to be completed on the record. So we are going to be starting a new record. You'll see that for the record type, you can choose born at this facility, born on arrival, home birth, intended or not, out of institution birth, or surrogacy court ordered. For this example, I'm going to say born at this facility. Plurality will be single. And when I choose single, the birth order and the number of live births in this delivery will automatically populate for me. And then I'm going to put in the child's information here. You can enter a suffix if there is one. That's things like junior, first, second, third, something like that. And then date of birth is next. And I'm going to say that the date of birth was today. Rivers has a nice option where you can type in the letter T, and today's date will automatically populate for you. And this is a double data entry field, so you do need to re-enter the value just to be sure that you've entered it correctly. Next is the time of birth. You'll determine whether it's AM or PM, and then you'll say the sex. The sex can be male, female, X, or not yet determined. For this example, I'm going to say female, and then I'm going to move on to the mother's current legal name. The title preference could be mother, father, or parent. I'm going to say mother for this example, and then I'm going to go ahead and put in the mother's information here. Suffix if there is one, if not, you can leave that blank, and then you'll enter the mother's medical record number as well as the mother's date of birth. The age at the time of the child's birth will automatically populate for you based on the date of birth you've entered. And then the facility information and place of birth is already filled out for me because I logged in today as Kent Birthing Center. Now at this point, I'm going to go ahead and save the record. Now the next button does not automatically save in Rivers. So it is important to save often, at least once on every tab. Rivers will autosave as long as you are working in the record, but if something goes wrong, like your power goes out or you lose internet connection, the system will not save unless you've recently manually clicked the save button. So it is a good habit to just save each tab as you go. Now I'm starting a new record and this is the first time I've saved, so it is letting me know that I'm creating a new record, and then it will save the record for me. Okay, you'll see now that the green check mark has appeared on the child tab because we have finished everything on this first tab. You'll see that the father tabs here, the father one and the father demographic tab, have green check marks even though we have not filled anything out for the father's information. And that is because unless you indicate that a father will be on the record, then the system assumes that there is no father on the record and those fields become locked. So a little bit later, we will indicate that there is a father on the record and those check marks will go away and those tabs will open up for us to complete the information. Okay, next is the mother tab. If the mother's name is the same, if the mother's legal name is the same as the name prior to the first marriage, then you can check this box and the mother's name will automatically populate. Mother's information is next. If you have a birthplace within the United States, you can just begin typing the state that you are looking for. If the birthplace is outside of the United States, then you would check this box here and it will filter foreign countries. Or you can begin just looking for the state that you are looking for in the drop-down menu here. Whichever way is fine. Social Security number is next. Marital status is next. So you can choose never married with PA, with court-ordered PA, or just never married with no PA. So PA is the parental acknowledgement piece for paternity. So you just make sure that if you are choosing one of these marital statuses, you are choosing the appropriate one for that record. Same thing, if they are married, they could be married with the husband's information refused. They could be divorced or widowed, 300 days or more with PA or without PA. They could be married or separated 300 days or more with PA, and then not stated or unknown is also an option. So just be sure to pick the correct one here. In this case, I'm going to say never married with PA. Now, the next sections about the paternity affidavit cannot be filled out until the paternity affidavit is done. So at this point, we're not going to do anything with the date the paternity affidavit was sent and the date the paternity affidavit was signed because we have not yet filled out any paternity documentation. But when we do at the end of this record, we will come back and we will enter those dates here. The mother's email address is next. It is not required, but it can be helpful if you do need to get in contact with the mother at a later date. So if you do have the mother's email address, that can go here, but once again, it is not mandatory. Social Security number is next. I'm going to say that yes, the Social Security number was requested for the child, and no, the Child Savings Account program was not requested. The mother's residence address information is next, so you'll go ahead and type that in here. If there is an apartment number, you can include it here. If not, leave it blank. Just like before, you'll go ahead and start typing the state that you are looking for. Unless they live outside of the country, then you can use the checkbox to filter countries. City or town is next, and now that I've chosen Rhode Island as the state, the cities and towns in Rhode Island will populate in this drop-down menu, or I can begin typing the one that I'm looking for, and it should pop right up. The county of Bristol will automatically populate once I choose the city or town, and then any zip codes for that city or town will populate in this drop-down menu for me to choose from. I'll say yes, this is inside the city limits, and then I'll check this checkbox here saying that the mother's mailing address is the same as the residence address, and I can go ahead and save this tab. Okay, you'll see that the mother tab is not going to get a green check mark quite yet because we have not filled out the paternity affidavit information here. The fields that are purple are unresolved. So until we resolve those, this tab will not get a green check mark. Next is the mother demographic information. I'm going to say that the education level is a bachelor's degree, and then you'll choose the primary language spoken at home. Now it does automatically populate to English. If there is a different language primarily spoken at home, you'll choose it from this drop-down menu, or you'll choose other or unknown. Mother's ethnicity is next, so you can go ahead and choose the ethnicity, and then as many race checkboxes as necessary, you can check off here, and then save this tab and go on to the father's tab here. So you'll notice when I said that there was PA involved with the mother's marital status, the father's tab did open up for me because there will be a father listed on this record. The title preference, once again, can be mother, father, or parent. I'm going to choose father for this example, and then I'll put in the father's information here. Once again, if there's a suffix, you can include it here. And then I'm going to say that the father's name prior to the first marriage is the same as the father's legal name, so I can check that box. The father's date of birth is next. The age will automatically populate here. And then the birthplace goes down here, as well as the social security number. Now, if the father's residence address is the same as the mother's residence address, you can check this box and then all of the information will populate for you and you can go ahead and save this tab. Next is the father's education level. So I'm going to choose from this drop-down menu. I'll choose associate's degree, and then the father's ethnicity is next, and the father's race. I can go ahead and save and go on to mother medical 1. So the mother's pre-pregnancy weight is next. I'm going to go ahead and put that in, as well as the mother's weight at delivery. The mother's height is next. And then you'll answer whether or not the mother received WIC during the pregnancy, whether or not she had the Tdap vaccination, and the influenza vaccination. Next is cigarette information. If the mother smoked cigarettes before or during pregnancy, you'll indicate that here. If you do choose yes, then you'll see that the number of cigarettes and number of pack fields do open up for me to complete. If you decide to enter the number of packs, then it will automatically populate the number of cigarettes based on the number of packs that you entered. Or you can just do the number of cigarettes. For example, if it was 2 cigarettes, then the number of packs would stay empty because that does not equal at least 1 pack. But for this example, I'm going to say the mother did not smoke and she did not use alcohol during the pregnancy. Now, if she did use alcohol, you would need to indicate how many drinks on average per week. If the mother was the informant, you can check this box and then the mother's information will come up here and you can save this tab. Next is Mother Medical 2. If this is the mother's first pregnancy, then you can indicate that here and you can move on to the next section. If it is not the mother's first pregnancy, then you do need to answer some questions about those previous births and other pregnancy outcomes. In this case, I am going to say this is the mother's first pregnancy, and then if the mother received prenatal care, you will indicate that here. I'm going to say yes, the mother did receive prenatal care, and then the other fields in this section open up asking me about the prenatal care visits. So first you'll enter the information for the first prenatal care visit, then the date of the last prenatal care visit, then the total number of prenatal visits, and the date the last normal menses began. If the mother was transferred for delivery, you will go ahead and indicate that here. If the answer is yes, you will need to say from which facility, but in this example, I'm going to say no. The principal source of payment, you can choose here. I'm going to say self-pay, and then if there are any sub-sources of payment, perhaps if they are using specific insurances, then you would indicate that here as well with the insurance number attached. I'm going to go ahead and save this tab and go on to Medical 3. The fetal presentation at birth is next. I'm going to say it was breech. The final route and method of delivery is going to be cesarean. And when I choose cesarean, you'll see that the next question does populate asking if it was cesarean, was a trial of labor attempted? And in this case, I'm going to say yes. Exposure, infections present and treated during pregnancy is next. So you'll just go ahead and check as many that apply in this list and then go ahead and go to the next section, which is if the infant is COVID-19 positive at the time of the report. So I'm going to say no in this example and then go on to risk factors in this pregnancy, once again checking all that apply. In this case, I'm going to say there was no risk factors and save this tab. Mother Medical 4 is next, which starts with the obstetric procedures, and once again, you will check all that apply. For gestational age calculation, you'll check all that apply, and I'm going to say physical exam and ultrasound in the second trimester. Characteristics of labor and delivery are next. I'm going to say there was an epidural or spinal anesthesia during labor. For more maternal morbidity, I'm going to say none of the above. And then for onset of labor, you can check all that apply. In this case, I'm going to say none of the above. I'm going to save this tab and move on to Child Medical 1, which starts with the child's medical record number. Next, you'll enter the OB estimated age gestation in weeks, the APGAR score, and if it is something less than 6, then it will ask you to enter the score at 10 minutes as well. So you'll enter a 5-minute score and a 10-minute score. If the infant was transferred within 24 hours of delivery, you'll go ahead and indicate that here. If the answer is yes, you will need to name the facility the infant was transferred to, but in this case, I'm going to say no. If the infant is living at the time of the report, you will indicate that here. If for some reason something happens and the infant is no longer living at the time of report, when you do finish this record and you file it for registration, this does need to be updated. So if the infant was living at the time of the report now, but then when you go to file the report, this infant is no longer living, then you do need to come update this before actually filing the record. If the infant is being breastfed, even partially, you will indicate that here, and then you will enter the child's weight information here. If you do use grams, then the pounds and ounces will automatically convert for you, and you can go ahead and save this tab. Next is the child medical 2. Abnormal conditions. Check all that apply in this list. In this case, I'm going to say there are none. And then any congenital anomalies you will indicate here. Once again, you will just check all that apply, but in this case, I'm going to say none. I'll save this tab and move on to the next tab, which is certification. You will enter the attendance information first by searching for the attendant with the green magnifying glass. You only need to enter the last name of the attendant, and you really only need at least 2 characters of the last name. The system will then search for all matching values in the system, and in this case, my attendant shows up right here in the drop-down menu. You can also choose other for the attendant, and you will manually enter the information, but since this attendant is in the Rivers system, all of the information will automatically populate for me. Now, if the certifier is the same as the attendant, you will check this box. If it is somebody else, you will do the same process by searching for the certifier using the green magnifying glass. In this case, the certifier is the same, so I can check this box and everything will populate for me. Now, since I've chosen the certifier will now get an email sent from the Rivers system letting them know that they have been designated on this record for medical certification. So they will need to come into this record, verify that everything is complete and accurate, and certify the record with their PIN number. I'm going to save this tab, and at this point, a pop-up will come up letting me know that this record is ready for certification. Now, as a facility user, if I try to certify this record, it will not allow me, even if I put in my PIN number, because I am not a medical certifier, so I cannot certify this record. It does have to be done by the medical certifier that was designated on this record. But when this pop-up comes up, you now know that everything is complete and ready for certification. Now, if I look at the unresolved stakeholders button here at the top again, I can see that almost everything is now finished. There are a couple of fields left on the Mother tab, which include the date of the paternity affidavit sent and the date of the paternity affidavit signed, and that's because we still have to do that paternity documentation before we can complete this record. The record status tells us the next steps on the record, and it says that the PA print is incomplete, the certification is incomplete, and then this record needs to be legally and statistically released. So you can click directly on the missing fields here, and it will jump right back to that field for you to fill in the missing information of the paternity affidavit in this case. Now, in order to get the dates, we do need to actually fill out the paternity documentation by clicking Record. And then down here, you'll see there's a denial of paternity, a voluntary acknowledgement of paternity signature section, and then a space where you can print the voluntary acknowledgement of paternity. You will print the voluntary acknowledgement of paternity first. You will have the parents sign the voluntary acknowledgement of paternity, and then you will upload their signatures. Once you print it and get their signatures uploaded, you will scan the document back into your computer, and then you'll go to where it says voluntary acknowledgement of paternity, and you'll choose which signature needs to be uploaded. In this case, there was no denial of paternity, so for this specific example, I only need the mother's signature. It does provide an option for a mouse pad signature where you could have the parent sign here, a USB pad signature, or an upload/scan, which is what you are going to do most likely, most often. So you are going to browse for the file. You'll find the one that you are looking for in your computer. You'll click open, and then you'll click upload document. Now in the preview section, it will give you a preview of that uploaded document with the signatures of either both the mother and father or the mother and or the father. Now in this example, there is no real signatures, but this is a very similar view of what you will see with the voluntary acknowledgement of parentage form preview. Okay, I'm going to go ahead and close that. And once you have the signatures uploaded, you can print the final copy of the voluntary acknowledgement of parentage. The record is successfully marked to indicate that the voluntary paternity acknowledgement has been printed, and then you will see the PDF show up here, and you can go ahead and print that off. Okay, now that we've done that, we can enter the date the paternity affidavit was sent, which I'm going to say was today's date, and then the date the paternity affidavit was signed, which I'm going to say was today's date. And now that I've done that, you'll see the check mark has now appeared on this tab, and we can save this tab as well. Now, once again, it's going to remind me that this record is ready for certification. However, I am not the certifier, so there's nothing I can do as the facility user to certify, but this record is ready for certification. So that is how you would start a new record, fill out the medical information, and upload the paternity acknowledgement documentation. In our next example, we are going to talk about how to do statistical corrections and amendments to a record. The state needs to initiate both corrections and amendments. You will need to contact the state by email or phone to begin that process. Let's talk about the difference between amendments and statistical corrections. Amendments are made more than 1 year after registration. The fact that there was an amendment appears on the certificate, and there is a fee associated. Only the state can complete the amendment process. It cannot be done at the facility at all. So the state will initiate amendments and complete amendments. Statistical corrections, however, are typically typographical errors. They are done under 1 year from registration, and they are minor corrections, so they have no fee. The correction will appear on the certificate, but the fact that there was a change is not on the certificate, and facilities can complete statistical corrections, although once again, the state will initiate those. So we will walk through that process now. I'm going to go back to the global module, which remember is sort of the landing page when you log into Rivers. I'm going to click birth again, and then I'll click function, facility statistical correction. And then any records that have been initiated for facility statistical correction will show up in this unresolved work queue filter. In this case, the state has initiated one record that I can choose from here. And it will show you an overview of that record, and then you'll click Record Statistical Correction. Now, as soon as it loads here, it will show you that you can edit or make corrections to any of the fields that have the wrench icon next to them. So the state does determine what is acceptable for facilities to correct, and you'll know which ones allow correction based on the wrench icon next to that field. So you'll find the one that you are looking for, the field that you are looking for to change, and then you are going to click the little wrench icon next to that field. So in this case, I'm going to edit some of the prenatal information here. For the date of Last Menses, I'm going to change that information based on new information that I have. And you'll see that the old data is here at the top, and the new data, or the data that I can make changes to, is down here in the middle. I'm going to make the change right here. And then I can leave any comments that I need to leave, and any supplemental documentation can be uploaded here at the bottom. For supplemental documentation, you can either scan a document, upload a file, or scan more documents, and then you will decide what the document type is, who issued it, and you'll enter the date issued and the date of the document. When you have everything entered, you'll go ahead and confirm the changes, and you'll see that this red exclamation point appears where I can see the original value on that field. So I know which field has been changed based on that red exclamation point. And if I click on it, it will tell me the original value. And when I click off of it, I can see the new value that is now on the record. I'm going to go ahead and save this now because there are no other changes I need to make. So I can click Process, Submit. And that is how you would create a statistical correction in the system. Now let's talk about next steps. You will be getting a recording of the webinar sent to your email from today's training, and a post-training PowerPoint is available for download. On this slide, you will find our support contacts. On behalf of the state of Rhode Island and QuantumMark, I really appreciate your time today and want to thank you so much for joining me. I hope you have a wonderful rest of your day.